Welcome to our podcast, where we cover unique and interesting stories for you. In this episode, we will discuss a study on India's 101 million diabetics, with Goa topping the list. India is home to 101 million people with diabetes and 136 million people who are dealing with pre-diabetes, according to a recent report published in The Lancet. This indicates that the metabolic condition affects roughly 11.4% of the nation's population. The Indian Council of Medical Research and the Indian Ministry of Health and Family Welfare jointly financed the country's largest epidemiological research on diabetes and chronic non-communicable diseases. All 28 states, 2 union territories, and Delhi, the nation's capital, are included in the research. Samples of a total of 113,043 people were used in the study. The Lancet Diabetes and Endocrinology, a highly regarded medical publication, has published the study's findings. Goa has the most significant prevalence of diabetes at 26.4%, while Uttar Pradesh, the most populated state, has the lowest at 4.8%. The study found that, with the exception of pre-diabetes, urban areas had a higher incidence of all metabolic NCDs than rural ones. According to the nationwide survey, 315 million Americans have excessive blood pressure, 254 million are obese generally, and 351 million are obese in their midsections. In addition, 213 million individuals had hypercholesterolemia or elevated cholesterol. It is quite evident from the study results that India has a substantial population at risk of cardiovascular disease and other long-term organ complications due to metabolic NCDs. Dr. R.S. Dhaliwal, Scientist G and Head, Non-Communicable Disease Division, Indian Council of Medical Research, told the Hindustan Times. The findings of this study are very significant, as they provide robust estimates of NCDs for the nation. Compared to earlier estimates, India currently has a substantially greater prevalence of metabolic NCDs. In India, the diabetes epidemic is in transition, with some states having already reached their peak rates, while others are just getting started. The study also demonstrates that despite the fact that all metabolic NCDs are more common in urban regions, rural areas have significantly greater prevalence rates than that reported previously. Dr. R. M. Anjana, Managing Director, Dr. Mohan's Diabetes Specialities Center, and President, Madras Diabetes Research Foundation, told the Hindustan Times. The severity of diabetes symptoms is determined by blood sugar levels. Some people may not exhibit symptoms, particularly if they have pre-diabetes, gestational diabetes, or type 2 diabetes. Symptoms of type 1 diabetes may appear suddenly and are more severe according to the Mayo Clinic. Type 1 diabetes and type 2 diabetes can both cause the following symptoms: noticing more thirsty than usual, frequent urination, weight loss without any effort. Ketones are present in the urine. When there is insufficient insulin available, muscle and fat are broken down, producing ketones as a consequence. Becoming worn out and fragile, irritated, or experiencing other mood swings. Vision that is hazy. Having wounds that take a long time to heal. Thanks for tuning in. If you enjoyed this episode, be sure to subscribe and share your thoughts in the comments. Stay connected for more exciting discussions and updates in our next podcast.